I'm Dr. David Arneson, one of the co-founders of the River Source in Mesa, Arizona. Where this all started was in 2000 when I left medical school, and I was invited to help participate and to help start an inpatient detox based on naturopathic principles and treatment. And in that first 2 years, we really sort of defined several different things, and one was, how do we address this chronic relapse, and what are we doing biochemically and neurochemically to help that person recover so that relapse becomes less of an issue. It was not information that was readily available because other people weren't doing this kind of work. It's using the principles of nutritional medicine in those early days where we started doing things like IVs and putting supplements and minerals and vitamins in the human body, starting the very first process of amino acid therapy. We sort of defined some parameters, what worked and what didn't work. When we left that program, we started the River Source in February of 2003. And we pretty much had what we needed in place. So we started doing things at the River Source that other people weren't doing out there. The analogy to what we do and how we approach it is sort of like this. It's if you want to repair the house that's been damaged in the storm, you must put into the house the correct repair materials. The problem always was impaired gut function, impaired digestion, and so forth. So we started doing IVs. Basically, that would be minerals and vitamins IV, which are essential coenzymes and cofactors to push forward this repair. Things that couldn't be absorbed through the gut in the first couple weeks can be absorbed in through the bloodstream. We understood that we needed amino acids to correct neurotransmission and those kinds of things, bring the serotonin and dopamine back up. But we didn't really refine that maybe until 2004, where we understood that there were certain principles, nutritional principles and metabolic pathway principles that had to be addressed. It couldn't be one singular nutrient, couldn't be another drug. Things had to be done in combinations. So we try to do things that allow the body to do the work, which is the way this does work, and not try to use too many medications, although we use them for treating symptoms sometimes, or make sure you don't have a seizure, so that the body would have this opportunity, and the DNA and the genetics in your body have this opportunity to work in an environment that was favorable to repair. Now, sort of the key behind it is not just about nutrition, because obviously this is body, mind, spirit medicine. That's the philosophy of naturopathic medicine. That the first thing we have to do is get the body and the physical form of the mind in good shape. We call it normalized, or working as best as it can, because we don't know what that sense of normalcy is for any one human being. But give the body and the body-mind, what we call the body-mind, a chance to recover. So that other part of the mind where maybe the addiction really truly lies, which is that need to do the drug when there isn't need to do the drug on the physiological level, but the addiction, so that the emotional mind has a normalized body biochemistry, neurochemistry, and a normalized brain neurochemistry. So we can make some headways. It's almost impossible to counsel a human being who's not doing anything to straighten this biochemistry and neurochemistry out. Almost impossible to counsel them in that first 3 to 6 weeks if we don't get this nutritional status back up and running. It's to the point where you start feeling better, and people say, well, how do you know it's working? Well, the patients tell us it's working because they start feeling better. So they can energize themselves, they can get involved in the counseling, they can get involved in the program concepts, maybe AA or NA, so they can start working on this addiction that lies on them, or this need to use for no other reason than an emotional need. Famous author in the past, Viktor Frankl, writes about 90% of the need to use alcohol or drugs, or 90% of the depression and anxiety in this world actually comes from the great sense of emptiness. We're not realizing our potential. We're not doing anything with our life. We're waiting around for something to happen. So in this program here, the River Source, for sure, one of the key jobs that most of us have, counselors or me or whatever, is to get your wheels turning, is to get you start thinking about the possibilities, about this realization of your own potential, so that you can meet the world, so you can come back into this world and start doing something that gives you that reason for giving up the alcohol, that reason for getting up in the morning. That sense of satisfaction at the end of the day, drug-free and alcohol-free, that allows you to take your place and to be part of this flow rather than apart from. In all this, there's so many modalities, not just the nutritional modality, which we think is the most important part because that's what brings the start of this. There's so many other modalities. We have acupuncture, which can help with pain issues. We have homeopathy, which can help with issues. We got physical medicine and chiropractic and injection therapy for joint pain and rebuilding joints. Here at the River Source, we have a sauna. We encourage people to get into the sauna, 2 or 3 times a week. To increase the body temperature, get the enzyme reactions going faster so the repair works faster, start detoxing. Largest detoxification organ in the human body is the skin, so we detox a lot of these toxic substances that we've been holding on to, either through our use of opiates or not eating right or liver dysfunction. So the sauna is a really important thing. But it's also a very spiritual journey. The spiritual journey is, we don't talk about religion because it's not about religion here. If you have a religion, we honor that. But it is about spirituality. And the easiest way to kind of understand that is the word spirit comes from the Latin word spire, which means to breathe, to feel alive, to have some sense of purpose, some sense of meaning in our lives, taking our place. A sense of satisfaction at the end of the day. In all that we do, whether it's the counseling or it's the AA journey, these truly aren't the answer to anything. They're the tools to help me find the truth of self. Most of us don't want to see the truth of self. Most of us don't want to be reminded of the truth of self. But without seeing the truth of self, we don't know what to change. So often we go back to whatever it was we were doing so we can escape from self. We're not running from the outside, we're running from the inside. So many times is in that process where we say, whether you believe in a higher power, or the energy that runs through everything, or the great mystery, the great spirit, or Wankantankan, or Jehovah, or whatever you want to call it, that reconnection to doing something with your life, to be of service to some extent. We'll never learn how not to drink or drug. We'll always know how to do that, something we'll never forget. But what we can do is we can learn to live our lives so we don't find the need to drink or drug. That means I need to take my place. Ultimately, there's no way to escape from taking that ultimate responsibility for self, for your own journey. Better to do it now. Better to go through a little physical and emotional misery and get your life back and have that sense of okayness than to wait, because it doesn't last forever. Today is a good day to start the process. Today is a good day to review. We're here to help you, but we need you on this train. We need you here with us. If you're standing in front of the train and yelling for help, you're going to get your butt run over. But if you're on this train with us, we can probably help you. I truly think, without reservation, without doubt, is the premier program for addiction and resolving issues with detoxification and withdrawal than any other program in the U.S. that I know of. In fact, maybe the world. People aren't doing this. The question might be, why aren't people doing it? Well, we're stuck in that standard medicine mode, and everything has to be a drug, and it doesn't have to be a drug.